So hello everyone, I'm Annalisa. I'm the Healthy Living Program Coordinator, and this is...
My name's Bree. I am the dietitian at Community Health Alliance.
And so for Obesity Care Week, we just wanted to talk about some topics that are great and relative to the work that we do here at Community Health Alliance. So first, I wanted to start off with asking Bree if she could do a quick explanation of what portion control is.
Yeah, so portion control basically just means eating an appropriate amount of a certain food. It's a great tool that we can use to help us avoid overeating or unintentionally consuming more calories than we intended to. A really good example of a time that might be good to practice portion control is when going out to eat at a restaurant. Because a lot of restaurants tend to provide some, larger portions nowadays, it's a good time to practice portion control there. You can do this by trying to share an entree with a friend or a family member. You can also try to order a to-go box right when you get your meal and put half of your meal away if you feel like that portion is a little bit larger than what you would normally eat.
Great. And so, Bree, could you go over what a plate should look like at mealtime?
Yeah. So a good tool to use when building your meals is something that we call the plate method. The plate method tells us that when we divide our plate in half, we make half of our plate fruits and vegetables, one of the remaining fourths grains, and then the last fourth would be your protein. And the plate method is great because it gives you kind of a visual representation of how much of each type of food to put on your plate. And it's an easy way to practice just eating healthy and nutritious in general. And it's also a great tool to practice your portion control.
Yeah, and I know when you're talking about the My Plate method, we could also apply that to like soups and stuff. So just making sure that we're adding in vegetables or just trying to add in vegetables where we can, right?
Yeah, definitely.
And so the last thing I wanted to talk about was intuitive eating. Could you talk about what intuitive eating is and also give an example?
Yeah, so intuitive eating, there are a lot of different components that can go into intuitive eating. Just in general, an intuitive eater is someone who really listens to their internal body cues and signals to tell us when we're hungry and when we're full. Intuitive eaters can recognize when they're feeling full, and they're comfortable with honoring those feelings of fullness and hunger. And most importantly, they can enjoy some of those foods guilt-free. So intuitive eating can also be a really helpful tool for helping us build a healthy relationship with food. An example of practicing intuitive eating could be if maybe tonight I'm making my favorite dinner meal, something that I could normally eat like 4 plates of because it tastes so good. But tonight I'm really going to pay attention to how the food tastes. And once I finish my first plate, I'm going to take a few minutes to sit with my food, and I'm going to ask myself how full I feel. And I notice that I do feel comfortably full after my first portion. So I listen to this feeling that my body is telling me, and I'm able to stop eating after this first plate, and I feel content and happy with my decision.
So really intuitive eating is just focusing on the food in front of you and also paying attention to how your body responds.
Yeah, and really honoring those feelings of fullness and hunger.
And so obviously if we're doing things like watching TV while we're eating, that could potentially make it difficult for us to be paying attention to how our body feels.
Definitely. That's kind of the mindless eating that so many of us often do. And ultimately we just eat more than we intend to.
Right. All right. Well, thank you so much, Bree. I think this is great.
Thank you.